Hi there, I'm Sheila Matias. I'm the president of the LaPorte County Commission, and I'm here with my colleague, Dr. Vijayakura, who's also a commissioner. Commissioner Merzinski was unable to be with us. He's working remotely this evening, and that is kind of our new normal, our new reality. So Dr. Porte and I wanted to spend just a moment talking to our community during these really stressful and tough times. All of us are struggling. We have folks in our families that are out on the front lines. They're, I call them our healthcare heroes. They are folks who are emergency responders. They are nurses, they're technicians, they're janitors at the hospital and at the long-term care facilities, who are really doing an unbelievable job helping our community stay healthy. Dr. Cora is on the inside track, so we have an expert with us this evening, and that's going to be really helpful. But at this time, I really want to talk a little bit about social distancing, and I know Dr. Cora is going to lead off with that. So, Dr. Cora.
Yeah, thank you, Commissioner Matias. First of all, thank you for your leadership during these tough times, and also Commissioner Merzinski. Actually, we have worked well together, and I appreciate this. Having two good colleagues to work with on the county commission. I want to thank the people of LaPorte County for mostly the response for social distancing has been good. There are still some individuals who feel that this is just like a flu, and they're not taking it as seriously as it needs to be taken. So I'm urging all of you to take this seriously. This is how it works. It is spread when somebody is in close proximity by airborne droplets, and sometimes the droplets can travel farther than 6 feet. So that's the reason why lately they have suggested to wear masks when you are out in a grocery store, and because sometimes we may or may not be 6 feet apart. And I am personally wearing a mask whenever I go in public. Of course, I wear masks when I'm in my office or in the hospital, in addition to other personal protective equipment when I'm seeing patients. But please make sure you protect yourself. And the reason the social distancing is important is not only to protect yourself, but to protect your family, your community, and also by cutting down the number of people infected with COVID-19, you'll make it easier for us, the healthcare providers, to take better care of you. Imagine if there are a large number of people who are getting sick and the hospitals get overwhelmed with large number of people. The resources that we have, even though we have ramped them up quite a bit, are still limited. And you have seen that in New York City, what has happened. So by social distancing, by staying at home, by taking precautions like that, you not only help yourself, but your family, your community, and also you'll help the healthcare providers. And it'll also help flatten the curve, which is happening in New York City. And lastly, I want to thank all my colleagues in the healthcare field. They're doing a phenomenal job, and I'm very grateful to all of them for what they do every day. I think together we can get this taken care of. Yes, we have had 3 deaths so far in our county, and my heart goes out to their families, and I extend my condolences to their families. But if we continue to practice social distancing, we can cut down the incidence of this disease and the complications and the fatalities. So please take this seriously, because this is a serious disease. Some of you may be thinking that, boy, this is having flu-like symptoms, but we do not know, because we are still studying who are the individuals who get really, really sick, and why do they get so sick, and why do they develop this severe pneumonia, ending up on a ventilator, and then ultimately they die from this disease. So that we do not have all the answers, but the best thing we have that is available in our armamentarium right now is social distancing, staying at home. Let's take that seriously. Thank you very much.
Thank you. So Dr. Cora just explained some of the medical things. What I guess I want to talk about is I really, in LaPorte County, we're a special kind of people. This is a great place to raise a family, great place to have a business, great place to live. We also are tough. We're Hoosiers and we are tough. This is a tough situation. We're getting bored, we're anxious, we're stressed. We're tired of eating the same things that are in our cupboard, finding those weird things in the back of the pantry that you've been meaning to use, but now you have to figure out a recipe for them. We've got parents who are now being teachers of their children at home. The children are antsy because they're used to being out in the world and mixing with other children. So this is a tough time, but we are tough people. We ask you again to take this seriously. Dr. Cora previously said, this is an ugly, ugly disease. We don't want this disease to pass through our community any further than it already has. And if each of us do our share, as Americans and as LaPorte County residents, we can stop the disease in its tracks. And that's what we plead of you tonight, and thank you for helping us with this big job.
Thank you.
Thank you.